Hey y'all, and welcome back to my channel. On this page, I talk about technology and money, and then also news and sometimes trending news. If you are new here, welcome to the channel. I'm glad the algorithm brought you here, or someone shared it with you, or if you're a returning viewer, welcome back. So today, I have a few topics we're going to talk about. It's going to be a relatively short video. Try to keep it under 30 minutes. I want to talk about Operation Nightingale, which has been all over the news. So some folks may have heard about it or read about it, but I'm going to talk about it and give a few thoughts from an informatics nurse perspective. I'm a registered nurse working in tech. I worked in tech for over 20 years, and I just have a few thoughts about the whole Operation Nightingale. We talk fake nurses. Going to talk a little bit, revisit the story I talked about last week around technology, retail healthcare and utilizing technology and what Dollar General is doing. And then we're going to wrap up with a story I just came across on yesterday about single women homeowners. And I love talking about money and reading about money, whether you are in a relationship or single, but it's some interesting trends that are happening with single women home ownership that I'm going to share with you all, that I want to share with you all. So I'm going to start by sharing my screen here. Let's see. So I'm going to start with Becker's. I like Becker's as an outlet because their content tends to focus on is very much what's happening in healthcare, not just from the hospital perspective, but also like operations, IT, regulatory, compliance, etc. So Becker's did a very short article on it. It's only like 2 or 3 paragraphs, and then I'm going to flip over to CBS News, which goes into a little bit more depth. But this is a Fed case, y'all. This is a Fed case, and when I first heard about it, I've been thinking about it and talking about it with my nursing friends. We have been texting each other and talking about it since the news broke a few days ago, like 2 or 3 days ago. So if you have not heard, this is a federal case where there were essentially fake nurses. These are nurses who never went. They went to nursing school, but their schools were not accredited. Some of them took the NCLEX. Some passed, many did not. But even the ones who did not pass went on to get roles as nurses working in healthcare facilities such as the VA, in long-term care facilities, working in home health with pediatrics. It goes deep, y'all. So I'm going to start with the story. 25 people have been charged for their alleged participation in a coordinated scheme to sell aspiring nurses thousands of fake nursing degree documents. And again, it's a Fed case, came from the Justice Department. So what the scheme involved is selling more than 7,600 diplomas and transcripts. So not just the degree, right? Because when you graduate, you don't just get your piece of paper. You also get a transcript, and your transcript shows like all of the classes you take. If you did practicums, what your practicum title. Also, it shows they have where you go on, where you're doing not orientation, but when you're in nursing school, you do your clinicals. Like all of that is on your transcript. So more than 7,600 fake fraudulent diplomas and transcripts from 3 nursing schools that have been shut down. They were all in Florida. And these schools sold people these diplomas and these transcripts, but these people had not completed any classes to graduate or sit for the National Council Licensure exam. So that like the NCLEX. So aspiring nurses would pay $10,000 or more. I did see one news story where they said they pay over $15,000, and that money fast track them to take the NCLEX. So if you don't know what the NCLEX is, it's a licensure exam that all nurses, registered nurses or LPNs, the ones for LPNs has a slightly different name, but it's a test that all nurses have to take. in order to get your nursing license, no matter what state you're in the United States. Now the NCLEX is 75. It starts off with 75 questions, but it can go up to, I think, 150, maybe over 200 questions. And as you are taking the test, the system automatically calibrates. Like if you do well, if you're doing well on the NCLEX, like as you're taking it, and if you're getting answers right or wrong, if you're doing well, the computer automatically cuts off at 75. And so when it cuts off at 7, and I say this because I did take the NCLEX many years ago, and it cut off at 75 for me. But when it cuts off at 75, you don't know at that moment in time, at least when I took it, it may have changed. You didn't know if you actually passed or if you failed. Now, when I took the NCLEX over 20 years ago, you had to wait a couple of days, and then you had to dial into the State Board of Nursing on the telephone to get your results. It may be different now. But if you're not doing well, or if you're doing so, the exam will go past 75 questions. So that's very high level, and it asks all types of questions about nursing, right? Just like if you take the bar, or like your real estate exam, or insurance, like it's testing your knowledge of the profession. So applicants who pass the test and gain licensure then allegedly use the fake documents to secure employment with, quote, unwitting healthcare providers throughout the country. Now, I have some thoughts about that. I'm going to get to the CBS News story, and I'll share my thoughts about these people getting positions in these facilities. And then here's a quote from the Health and Human Services Officer and Inspector General. So the Health and Human Services Office of the Inspector General worked with the Federal Bureau of Investigations and the Justice Department to launch this Operation Nightingale, which is named after Florence Nightingale, who is known as the founder of modern nursing. But we cannot also forget about Jamaican nurse Mary Seacole, but that's a whole nother video. To take down the scheme after a Florida state audit identified poor NCLEX passing rates at the 3 nursing schools. Now, what I don't know is how long these schools were allowed to continue to operate with these poor NCLEX passing rates. At least I know in my state, with the schools, after you have students, after a certain amount of time, if your student performance on the NCLEX is not well, like they put you on a warning, or they can shut your nursing school down. I don't know if the passing rate has to consistently be over 85, 86%. Someone correct me if I'm wrong in the comments. But it can, at least I know that's how it goes in my state. So in total, 25 people face criminal wire fraud and wire fraud conspiracy charges in 5 states. So Florida, New York, New Jersey, Texas, and Delaware. And they face up to 20 years in jail. It doesn't say how much money they may have to pay. And then additional action may be taken against nursing applicants who allegedly purchased the fake diplomas. Like, here's the thing within healthcare. You have to be, I said I was going to wait until I got through the CVS story, but I just want to take a moment. It never pays to take shortcuts. It just does not. And hey to ACD 4N nurse educational consultant. Here's the thing, healthcare and taking care of human beings, just like flying a plane, well, just like any position where a profession where human being lives are in the balance, that is not the time to take shortcuts. Whether you are a nurse, whether you are a firefighter, whether you are a pilot, a surgeon, a pharmacist, it's just not the time or the place to take shortcuts. And the same within financing, within banking. Shortcuts never work out in anyone's favor for the long term. A shortcut may work out for the person who's doing the shortcut in the immediate term, but they don't work out for, they just don't work out in the short, and it's just not the time. And I'm not laughing in like it's a funny, but it's just not, that's just not something you want to do. And it never works out, and it should not be done. So here's the CBS News story We're about halfway through this story. I'm going to share a quote, what the American Nurses Association said. The ANA just got a new president. So Dr. Ernest Grant, his presidency in the ANA came to an end in December, and the new ANA president, she has began her term. So CBS News, it talks about, again, 7,600 fake nursing diplomas, wire fraud scheme, etc. So thousands of practicing nurses in the United States could potentially be working with bogus academic credentials after federal officials uncovered an alleged scheme at the 3 nursing schools, which I just talked about. They're all now closed, but the schools are called out. So Siena College, Palm Beach School of Nursing, and Sacred Heart International Institute. More than 24 people have been charged, and they engaged in a scheme to sell fraudulent nursing degree diplomas and transcripts from accredited based nursing schools. And again, they face up to 20 years. Here we go. So the nurses with the fake degrees, here's the thing, where they went to work. Because that was when I first heard this, I was like, where are these nurses work? First of all, are they still working? And where are they working? And what type of patients they're working? It doesn't matter the type of patients they're working with, but I was just really curious where these people were. So they went to work in settings such as homebound children, so it goes to talk about the home health care with pediatrics, assisted living facilities, the VA, and several states, and I already mentioned the states. So they were able to get obtain licenses and jobs as registered nurses, licensed practical nurses, and licensed vocational nurses. That's why on my channel and on TikTok, when I tell people, when I say nurses, I'm talking about all types of nurses like this, because they all are nurses, no matter what level that you're practicing in. So the U.S. Attorney for the Southern District of Florida said it erodes public trust in our healthcare system. It is really scary. It is a public safety concern. It says, this person also said, it also tarnishes the reputation of nurses who actually complete the demanding clinical and coursework required to attain their professional nurses and employment. Here we go. And it goes on to talk about the counties within the states that people are charged with. So I was like, how did they do that? So what the prosecutor said was they solicited and recruited people seeking nursing credentials, and then work with this person at Siena College to create and distribute false and fraudulent diplomas and transcripts that were sold to thousands of nursing applications. Who are these people? Who are these people that were selling these fake nursing credentials and these fraudulent diplomas and transcripts? Like, I want to know like their backgrounds, because it goes back to what I was talking about, shortcuts. Shortcuts never work out in the long term in people's favor. People may get away with doing shortcuts and things like that, but something along the line is eventually going to erode. And like within healthcare, I don't understand how these people thought that they would long-term be able to get away with this. And I don't know how long they were running this scheme. But anyway, so the papers that the people received incorrectly stated that the aspiring nurses had attended the Broward County nursing program and completed their courses and clinicals. Now, every nurse I know that has gone, I don't know, not one nurse that has completed nursing school, including clinicals, and don't have stories about how challenging and difficult it is. The road to becoming a nurse is not easy, right? And the fact that these folks essentially try to take a shortcut, it doesn't settle well with me in my spirit. So I'll go over to the ANA's comment here in the moment where she talks about, how about the profession. I believe that's the end of this article. So let me just share the ANA, because of course I wanted to see what the ANA said. I've seen the news outlet stories, I've seen the TikToks folks have been making, but I was really curious if the ANA was going to release a statement and what they said, and they did. So I'll just briefly read over it. She said, this disturbed, and the ANA president is Dr. Jennifer Kennedy. She is from the state of Oregon. She worked with is it Oregon or Washington? It's either Oregon, the state of Oregon, or the state of Washington up in the Pacific Northwest. And she worked with that state nurses association for a couple of years before becoming president of the ANA. So she says, quote, this disturbing news of a coordinated conspiracy allowing individuals to circumvent necessary coursework and clinical experience, as well as critical steps in the nursing licensure and credentialing process, is extremely unsettling. Nursing is without a doubt a highly specialized and ethical profession requiring rigorous and lifelong education and training to acquire unmatched clinical expertise. You don't achieve this overnight. There are no shortcuts in nursing. Our patients and clients depend on us. I'm going to pause here because what really concerned me about this as an informatics nurse, right? Because I have, even before I became an informatics nurse and worked in tech, when I was working at the bedside and working on the floor, I have oriented nurses. Then once I transitioned into nursing informatics at a tech company that no longer that has changed. When I was orienting back then, I haven't oriented someone in a while. That was a nurse. I've oriented people since then, but I'm talking about orient nurses to nursing informatics. During orientation, even when I was at the bedside and informatics, you can, if you are an astute nurse, even as a fresh orient mentor, etc., you can tell if someone has the foundations of a good nurse, of a nursing education, right? And not everyone learns at the same pace. Not everyone take on new concepts. Nursing school does not teach you everything. I've seen people on TikTok say nursing school doesn't teach you how to be a nurse. It does not teach you. It cannot teach you everything how to be a nurse, because you're always learning. But the key to nursing school is it teaches you the fundamentals, like your ABCs, your airway, your breathing, and your circulation, how to put someone in Trendelenburg, how to assess for wounds, how to assess your patients if they're fall risk, how to look things to look for if your patient is decompensating. Nursing school doesn't teach you everything, but nursing school teaches you the foundation. So when I've seen some of these creators, like on TikTok, mainly TikTok, and people in the comments saying, well, nursing school, no, it doesn't teach you everything, but it does teach you the foundation. And reason why I am side-eyeing is because now because I know 20 to 30% of these people pass the NCLEX. I did see up to 30% passing, right? So that's 3 out of 10. So, but even if you pass the test, you still, once you go into a facility, you still have to be oriented. I know the first facility I worked for, and I know they still do this, is you have to pass a medication test. Yes, they before you hit the floor, they see if you have the basic foundations. Do you know how to calculate? In that medication test back then included, you had to calculate your drug doses by hand. We could not use calculators in nursing school, and even at the hospital, my first hospital job. Other thing to see if you have the foundation, and the fact that these people made it off of orientation, I am hoping at some point the facilities that these people are working in, that someone is looking at the orientation and sign off process. Because if these people, even if they passed the NCLEX or did not, how did they get past orientation? Because I have oriented people who now I haven't oriented someone. I say they just can't work here. I have worked with people who you may have to extend the orientation because it may take them. People learn at different paces, especially when you're a new grad. People, it's a lot. It is a lot as a new grad, right? And so, but even if they were on orientation and maybe the orientation had been extended, I'm trying to figure out how these people made it off of orientation and was actually able to care for patients without a mentor or someone to follow them. So ACD4N says, exactly, I know a nurse who went to Florida to attend nursing school and never spent a day in clinical. I don't know how that happens. Oh my goodness, I am flabbergasted. I had no idea. And that's one thing I have seen some TikTok nurse creators talking about, that it has been going on for so long. And I just did not know it was a thing. I honestly did not know getting a fake nursing diploma, even before this Operation Nightingale, etc. I did not know it was a thing. And I did not know people could go to nursing school for LPN, RN, etc., and not have to do clinicals. Even when I went for my master's degree in nursing informatics, I didn't have to do clinicals, but I did have to do an extended, almost like a clinical. I worked with a nurse who was an executive at a tech company, and I had to do, I think, like 40 to 60 hours. 400. I forget how many hours, but I just didn't know nurses could make it out of, or could go to make it out of nursing school without doing no type of clinicals, even if in a lab. But especially with real patients. So this was very unsettling to me, this whole story, because you think about that shortcuts should not be taken when human lives are on the table. A train conductor, a pilot, a pharmacist, a surgeon, a registered nurse, a firefighter, right? Because human lives are in the balance. And it is just, this story really did, it really did disturb me. I'm not gonna say that it did not. And I know there have been, and I will say, this is my last thing about it. When I first saw the nurse content creators making jokes about the fake nurses, so I was like, well, wait a minute, these are human beings, people's lives were really in the balance. And I had to just, tell myself, I understand, there are different people express their concern about a situation in different ways. But I just feel like this was a very serious situation. And I just didn't know it was a long-term thing. Okay, off of that, on to just revisiting quickly what Dollar General is doing. And I talked about this Dollar General and what they're doing, utilizing technology for healthcare last week. But what I did not realize back then, last week, was that these Dollar Generals that they have launched this retail health delivery service, .go on demand, is in rural areas. And there have been there's a lot of work happening at the state, federal, local level with trying to improve rural healthcare. There's people who still don't have access to broadband, let alone have access to acute care facilities. The same being with, their access to food and being in a food desert. So advisory board, and I like advisory board, just like with Becker's advisory board. I tend to heavily favor what they put out because they use best practices and they partner with different healthcare facilities, research partners, companies like that to release articles and news and information from a best practice perspective versus going from a traditional news outlet. So Advisory Board did this really interesting article 2 days ago about what Dollar General is doing and if it can really make an impact to rural healthcare. So if you have not heard, I'll briefly visit this article. It says Dollar General has launched a pilot program for mobile clinics at 3 Tennessee store locations, which will offer on-site services through a partnership with medical, mobile, and transportation services provider .go, which also is called .go on demand. So .go on demand is not new. I know they have I know they have outlets up in New York and a couple of other areas, but with .go on demand, you can use their website. They also have a mobile app, and you can have the provider come to you, whether that's a physician or an advanced care practitioner, like an APP, like a nurse practitioner or physician assistant. So it allows the healthcare to come to you. And I said last week, and I'll say it again, I think this is a great idea because, you know, some people may have challenges with transportation, with mobility, accessibility, etc. And to be able to have the healthcare come to you, I think is awesome and very innovative. And what .go does and what Dollar General is doing, they provide medical services. You can get help for acute care conditions as well as chronic conditions like diabetes, asthma, high blood pressure. And then you can also get like annual physicals and things like that. So let's see. Let me scroll down. All right. So the partnership will give customers access to quick, easy health visits right outside the store. .go, which refers to itself as a last mile provider, sends clinicians to locations to provide care that would typically require patients to visit a physical clinic. And like I said last week, I think this is great. I have family that still live in rural areas. I have some family members who still live in the low country of South Carolina on dirt roads and miles away from a healthcare, acute care facility, or even an urgent care. But they do have the towns where they live do have Dollar General, or they also have like a Family Dollar or a Dollar Tree. But just the towns down there do have a Dollar General. And I think it's great because I know in the rural areas where my family is from, and I'm assuming this is also like this in Tennessee, the Dollar Generals are really big, and you can get not only like traditional things like, you know, Pampers and clothes and greeting cards, but you can also buy a wide variety of food. And I know people who do a lot of their, if not the most of their grocery shopping at a Dollar General. So people are already visiting these stores, and they have access to also get healthcare while they're there. So as I mentioned, they do talk about the services they offer: physicals, checkups, vaccinations, immunizations, and lab testing as well, so they can get their blood drawn. In addition to the chronic conditions I already mentioned, they do accept Medicare, Medicaid, so private as well as private payers, so both governmental and private payers. And then it says if the pilot is successful, they're going to expand. But let's talk about if it could be a game changer for rural healthcare. So the article does call out that Dollar General is not the first to do retail healthcare. You know, CVS Health, which, you know, Rosalind Brewer, who used to be over, I believe, Walmart, she's the CEO now of CVS Healthcare. They're doing a lot. You know, they have the Minute Clinics, Walgreens. I know there are Walmarts out in Arkansas where you can get dental services as well as healthcare services. Best Buy got into retail healthcare about 2 or 3 years ago. So it's not new with retailers getting into the healthcare business. But what Dollar General is doing in rural healthcare is new. And it's the first time you have seen where a company is specifically targeting a population of people that traditionally have difficulty accessing health services. So it says Dollar General's widespread presence in rural areas could serve as a competitive advantage. Currently, the customer estimates that 75% of the U.S. population lives within 5 miles of one of these stores. This is smart what Dollar General is doing. I need to go look and see who is on Dollar General's executive board or who works for their company, because targeting this market, of course, you know, it is capitalism, okay, but it's also capitalism with a purpose, and it's actually solving a problem that people have regarding receiving healthcare. So I need to go and look. That's something I may go out. I mean, I will go out and do to see who is on their board and who is advising them to make these decisions, because it's very smart. So still, as Dollar General continues to expand its healthcare presence, some experts have noted that the retailer may face staffing issues like those that exist in the larger healthcare sector. Let me just say for a minute, I have never not known for people to say that there is a nursing shortage. I've always heard people say, "Oh, there's a nursing shortage." That is like nothing new. It's just yes. So, and then it talks about they'll have to do some work around their recruiting and competitive salaries. So, really interesting. And as always, I'll be sure to leave a link to the article in the reference box. Let me do a quick time check. Oh, we're right at 30 minutes, and I'm going to wrap up here. Definitely address many barriers to care. Absolutely. That's why I think what they're doing is awesome, and I love it. Thank you for the comments. And also, if you're still watching, please, or you're watching this for the future, please do like the video and share it as well if you're finding this information interesting. And the last topic I'm going to talk about, because you all know I love reading about money, making sure that I'm a steward of my money and my family's money, generational wealth for us, but also for women, no matter what your relationship status is. And Forbes did this really interesting article that I came across about single women home ownership. And I won't read through the whole article, but I'll just touch on it. It says single women are more likely to own homes than single men in nearly all states. And it goes on to talk about out of the 50 states, 48 of them, single women are outpacing single men in home ownership, which this blew me away. I did not realize that, all the changes that we're seeing within the modern world, and all the advances that women are making in their careers, with their families, in their personal lives, with their money, with building wealth, etc. I just did not know it was also strides were also being made within home ownership. So it says that single women who live by themselves are more likely to own a home than single men in 48 of 50 states. So what Linden Tree did was they looked at data from the U.S. Bureau of Labor Statistics and found that while women earn 83 cents to every dollar a man makes, and for Black women, it's even less than that. I think while women overall make 83 cents to every man's dollar, Black women make approximately 60 cents to every man's dollar. And it's different. And also there's some variability there for Asian women as well as Latinx women. Women own about 2.46 million more homes than single men. I just found this so interesting. Single women own about 10.76 million homes, while single men own about 8.12 million, or they say it in another way, single women own an average of 12.9% of the owner-occupied homes in the 50 states versus a little bit over 10% among single men. Out of all the states where women are outpacing men in terms of home ownership, it says Louisiana has the highest share of homes owned by single women. And I don't know what's going on down there in Louisiana, if it's the cost of living and what is the industry down there. I need to look. The two states where it doesn't outpace, where women are now not outpacing men in terms of home ownership, single men versus single women, is North Dakota and South Dakota. And I don't know a lot about that part of the country in terms of like the industries and the type of work people do out there. And that's it. It calls out the states with the highest ones. And it's just interesting. So despite the data showing women generally earn less money than men, the gender gap script is flipped here. And it says the explanations could be single women prioritize home ownership more than single men, perhaps. There's also evidence that single women are more willing than single men to make sacrifices to become homeowners. This could help explain why single women own a greater proportion of homes than single men, even if they're often less financially well off. It's really interesting. So it goes on a little bit more, and the article talks about ways that women can protect themselves and their money if they do want to pursue home ownership. But I'll leave a link to the article in the description box. That's it, y'all. If you made it this far in the video, I hope you enjoyed it. Please do like it and also share it. And I welcome you to leave a comment And I'll see you. Take care of yourselves, and I'll see you in the next video.